for my speech right there. My name is Lauren. I'm a registered nurse at Lancaster Rehab Hospital, and this speech purpose is to inform individuals about euthanasia and physician-assisted suicide and why it's unethical. So euthanasia has been a hugely controversial topic in America for as long as I think a lot of people can remember. A 2011 Gallup telephone survey found that 45% of Americans believed that the practice was morally acceptable. However, a slightly larger 48% disagreed with that and believed that it was unethical to perform euthanasia here in America, or really anywhere. The definition of euthanasia includes the action of inducing a gentle, painless death of those suffering from incurable or extremely painful diseases. And also a physician-assisted suicide includes a physician providing medications or other means to patients to help them complete suicide or complete the wish for them to die. With the understanding of that, the first physician to assist in these physician-assisted suicides was a doctor by the name of Jack Kirkoven. He was a man that started doing physician-assisted suicides in the 1980s. This is him with his suicide machine from things he found around the office and in his kitchen, actually, to first help patients induce suicide. With that, again, he helped over 130 patients with their deaths that they had wanted to occur, but he was eventually convicted of second-degree murder and unethical behavior and convicted to about 25 years in prison. The medications that are also used in the physician-assisted suicides include things that are also included in the death penalty. The purpose of the drugs are to induce death in a manner that is painless as possible for the individual. These medications include sedation drugs to render the condemned unconscious, a neuromuscular blocking drug to cause all the muscles to cease in the body except the heart, and then ultimately they also get a lethal dose of potassium chloride last to arrest the heart. The medications are again supposed to be quick and painless. However, they can be painful and drawn out if the improper amount of medication is delivered, according to an article on pharmacology done by Dr. Cole in 2014. The proponents of euthanasia and physician-assisted suicide contend that terminally ill people should have the right to end their suffering in a way that they feel dignified and appropriate. When discussing some main arguments, one of them that comes to mind includes the right to die. So the pro side on this topic argues that the right for competent terminally ill patients is to avoid excruciating pain through death that allows them to alleviate their terminal illnesses. With that, the exercise of this right, they believed, is central to personal autonomy and bodily integrity. This also includes some rights that go along with it according to the pro side, including marriage and procreation and the refusal of termination of life-saving medical treatment. The con side argues that this asserted right to assistance in committing suicide is not a fundamental liberty. Human life deserves expectational security and protection. Avoiding medical technology has made it possible to enhance human life and the quality of life that are lived. Palliative care and rehabilitation centers are better ways to provide a quality of life and provide palliative care for individuals who are nearing the end of their lives. Another main topic involves patient suffering at the end of life. Pro sides argue that it is a human right not to be forced to suffer. It should be considered as much of a crime to make someone live who does not want to continue, as it is to take life without consent. The con side, however, argues that laws against euthanasia and physician-assisted suicide are in place to prevent the abuse of almost killing people from immoral doctors. They are not and have never been intended to make anyone suffer. Even doctors cannot always predict firmly when someone is going to die, or if remission is even a possibility to help them continue to live their life in a better manner. So implementing euthanasia would mean many unlawful deaths of individuals that could have survived or could have had better quality of life with rehabilitation programs or with palliative care. Utilizing euthanasia would increase distrust of patients towards doctors. Another point includes religious concerns. The pro side argues that human life is inherent with dignity, which may be compromised when life is extended beyond the will or ability of a person to sustain life. The con side, however, argues that life is the most basic gift of a loving God, a gift over which no person has absolute dominion. A moral obligation to care for our own life and the health of others provides that we should set circumstances that do not provide ways to help people with assisted suicide. The tradition clearly and strongly affirms that a responsible steward of life, one must never directly intend to cause one's own death or the death or harm of an innocent victim by action or omission. So it would be wrong to treat lives as worthless to conclude that some individuals would be better off dead. Opponents of euthanasia and physician-assisted suicide contend that doctors have a moral responsibility to keep patients alive with the Hippocratic Oath. They argue that there may be a slippery slope from euthanasia to murder, that legalizing euthanasia would unfairly target the poor and disabled and create incentives for insurance companies and other businesses to gain from people's deaths. When discussing the Hippocratic Oath, the pro side argues that over time the Hippocratic Oath has been changed a number of times and modified to get rid of some doctrine that's less acceptable. Some of that doctrine includes that women cannot study medicine and that no breaking of the skin could be occurred through patients. Much of the quota references, however, to do no harm is also in need of explanation according to some. Does not doing harm mean that we should prolong life that the patient sees as a painful burden? Surely the argument is that the harm in this instance is done when we prolong life, and no harm means that we should allow the patient to die. However, the con side argues that prohibition against killing patients stands as the first promise of self-restraint sworn in this Hippocratic Oath. The promise being, I will never give a deadly drug to anybody if asked for it, nor will I make suggestion to this effect. By stating this, the physicians agree that they will not harm their patients, nor will they participate in suggestions of harming their patients. For a physician, at least human life in living bodies commands respect. The deepest ethical principle restraining a physician from allowing patients to die is the ultimate form of autonomy for them with their intentions to do good and not to harm people. An insidious attack is directed at people who do their best to help fellow humans in distress. Not the death and disease, but the doctors and their machines are revealed as the enemies here. The right to die is forcefully emphasized, as if dying were indeed a right rather than a sad inevitability. The theme of dignity is widely exploited. We are told that to be assisted by medical technology to prolong life entails that dignity is lost. And we are told that a way to die in dignity is to let yourself be killed by a professional. A special soothing language is used to make it easier for the public to accept euthanasia, where the balance found between individuals intending on helping ease the pain and suffering of people by allowing their suicide and individuals intending on improving the human race by extermination of weaklings. Physician-induced death has become commonplace and is treated accordingly. To many patients, the legal injection is administered shortly after the request. However, in some instances, patients have had their euthanasia prolonged because they wanted to spend another holiday or another birthday with their loved ones. This raises doubts about the rationale for euthanasia. If it can wait, Is it really urgent, and is it really necessary? People become pressured when families get involved, and they do not always choose the best options for themselves. People will feel the need to justify their existence. If the road to euthanasia continues, who will ultimately have the power to take life away from individuals? How will we ultimately know when someone has suffered enough? And what will occur if euthanasia or physician-assisted suicide spirals out of control? Who then is to stop the termination of lives?